Sheri, my name is Greg. I'm going to be your clinical examiner.
Hi.
This is going to be your assignment right here for this particular patient. Okay. Your patient is a 50-year-old male, 50-year-old female, and they were actually admitted for COPD exacerbation. They have a secondary diagnosis of hypertension, hypercholesterolemia, dementia. They were admitted 2 days ago. Okay, they have not had any surgery right now. Okay, their diet is a regular low-sodium diet. They're on bed rest. Their side rails should be up ×2. They have no history of any falls at this time. No known allergies. They do wear reading glasses, and she is a little hard of hearing. Okay. Now, you have been assigned comfort management, and we want you to use a 0 to 10 verbal comfort scale with this patient. You've been assigned fluid management. We want you to administer some medications, which those will be listed on your MAR.
Okay.
And we want, you're going to be assigned oxygen management and vital signs. Okay?
Okay.
All right, now, I'm going to give you a chance to look through the chart to see your vital signs. I have listed the previous vital signs that the patient has right here,
Okay.
so that you can use this during your planning phase.
Okay.
And I'll be sitting right here if you have any questions whatsoever. Do you have any
Okay.
questions right now?
No.
None? Okay. So I'm going to go ahead and place that right here for you. I'm going to hand you this back right here. Okay? Now, the time, the official start time, what time do you have right now?
9:40.
0940.
Okay.
I'll write that down.
Okay.
Is your start time is going to be 0940.
Okay.
You have 2.5 hours to complete this patient care scenario. Okay? You ready?
No.
Start.
Okay. So let me just look at my assignment real quick, and I want to get my highlighter out and highlight the important things I got to do. I have a question.
Yes, ma'am.
You told me that they didn't have any falls.
They haven't.
It is marked on here, yes, they have.
Okay, I'm so sorry that they have had a fall within the last 2 days.
3 months.
3 months ago. They have not had a fall within the last 2 days. Is that correct?
Right, but
Okay.
they have had in the last 3 months.
Okay.
So I just wanted to clarify that.
Yes, ma'am.
Okay, thank you. It also says the patient's on bed rest. Are they using a bedside commode, or is it strictly a bedpan? Since I've got intake and output, it just says bed rest. So
Yes, you're going to have to do that in the bed.
a bedpan if they
Bedpan.
need it. Okay. Okay. Before I get started on my care plan, I'm just going to take a few minutes and do my grid.
Okay, so after Sheri has asked her questions, she feels like she's prepared to go ahead and start moving forward. Now she's going to go to the very back page of this Appendix A, which is actually part of the study guide. She's going to go back to the very back page. It'll be blank. And she's going to draw this grid on the very last page of her packet. Okay? All right, it will be blank. Okay? The grid is nothing more than a 12-box systematic approach that she's practiced at home, and she's transferring her entire assignment from these multiple pages over here to this grid. One of the other things that you saw Sheri do is she highlighted her entire assignment. That highlighting of the assignment actually draws her focus away from what she's not assigned and causes her to focus on just what she is assigned. So it's a very effective use of a highlighter. At this point, your CE is probably going to be up and moved away from you. They're probably going to be within your line of sight, but they're not going to be anywhere close to you. So you're just going to be kind of alone in your own world right now. And once again, she's writing it on the board so that all the students on video can see it. This will be written on the very back page of the actual PCS card, Appendix A, which is actually a PCS packet. You'll also notice that Sheri's using a red marker along the actual body is in black. She uses a red marker to annotate anything that's hyper important or extremely urgent. That's the significance of having the red. And for you guys, it'll be like one of those little 4-color nurse pens that you may want to use for this process right here. They're very helpful. Now you notice that the consistency that we actually will teach you is to use the first 5 boxes as the same for every PCS. Your grid, the first 5 boxes will be set up the same. Box number 1 is your entry box, and everything that you're going to do as you enter the room will be taken care of in that box. The second box will be your 20-minute check box, also known as fluid management box. Third box will be the vital signs that she's been assigned on this particular patient. She's got her patient's mobility status in the 4th box, and then she's going to be giving medications to the patient during this particular PCS. That's going to be in the 5th box, and those will always stay consistent on every single PCS. Okay? At least practice that way until you get hyper comfortable with it. Then you can think about moving boxes around, but we say keep the 5 the same. You'll notice that Sheri's also put the med time, which is very, very important. You don't want to, you don't want to be getting into the room and forget when to give your medications. So, right beside the medication box where it says the meds, she put the time that the meds are due. Now you notice now she's writing in blue ink on her grid. The blue ink signifies any information that she was given by the primary nurse or during report. And in this scenario, this CE, myself, I was her primary nurse. So I gave her all the report information. But also anything that she gleaned from the chart, she will also put on her grid in blue. It's kind of a way of her separating things in her brain. So now she's using the green part of the pen. The green part of the pen is used for your go-to person. Okay, on your care plan, you're going to have to list who your go-to person is. Okay, who would you use for that particular box? So if you've got a mobility box, you may want to use your tech or your UAP. That would be the person you probably would use for your mobility box. That would be your helper. Okay? Now if you see right here under the comfort management, she's got the RN. So the comfort would be implemented by the RN. All comfort measures would be implemented by the RN. So if you had to delegate that task to someone, you would delegate that to the RN, and that's why she put RN in the comfort box. Under the oxygen management, you'll see RT, which stands for respiratory therapy or respiratory therapist. She would delegate that task to the respiratory therapist if it came down to a delegation situation. The reason she's added this to the multiple boxes is because just on the off chance she puts it down there to kind of give her an idea who would be the go-to person in that box, of course. If she were to come up into a revision situation, she would already have that information on the box, and it would make the revision much, much easier for her to do. So that's why she tags these different boxes with the go-to person in the green marker. Okay?
Okay. Time for me to write my care plan.
Okay, so we're about 12 minutes into this part of the planning phase. Okay, so it actually probably is around 11 minutes that Sheri actually took report, started the clock, sat down, did her highlighting. She asked me some questions about the fall, the bedpan, and then she began the process of transferring everything to the grid. And she literally stood up here on the board and did it on a board. So you can imagine that 12 minutes, she still has like 18 minutes left to actually write her care plan to meet her. She has a goal of 30 minutes to do the grid, the care plan, everything that she needs for the planning phase. That's her initial goal. Okay? So that's her budget for the PCS is 30 minutes for the grid and the care plan.
Yeah, and just so you'll know, I've already completed my care plan. I'm going to take a minute and write it on the board so that everybody can see it, but I'm actually done. So, however long that took.
3 minutes at the most. She's been practicing. If you've watched Sheri's videos at all, you'll notice she's not put the ma'am over on the left-hand side, left lower box. That stays the same on every single PCS. And you'll see the ma'am, managements, assessments, medications, and mobility. And she's actually filled those out. That's her way of giving herself the ideas of what she's going to use for her initial care plan. Okay? So she's thrown that information on the grid, and that basically, those are the NANDAs that she possibly could be using for this particular patient. So just remember, she's written her care plan based on what she's put inside that box. Are you going to explain that, Miss Sheri?
What?
Or do you want me to explain what you're doing?
I'm just filling out the plan of care form.
So on page 90, she's transferring this information all to page 90 of Appendix A. That's in your PCS packet. It's actually the plan of care. So she's done her grid on the very back page, and now she's using all that information to fill out her care plan. Upper left-hand box, 2 assessments. Okay? So the patient data to support your development of the nursing diagnosis, those 2 assessments. The patient is jittery, and the patient can't get comfortable in bed. So that's what she's going to write in those 2 boxes. She's going to continue downward on that same page. And she's given the nursing diagnosis or the NANDA label of impaired comfort. Okay? In the next box below that, you'll see where it says the rationale for the selected nursing diagnosis. And Sheri has written, being comfortable is essential in the healing process. If patient is not comfortable, they can't manage their gas exchange and are at risk for pneumonia. Her related factor for this particular care plan is going to be COPD. The expected patient outcome, the patient will rate comfort at a 5 or greater on a 0 to 10 verbal comfort scale during PCS. Her 2 nursing interventions for this care plan are going to be position the patient upright. The rationale for that is it facilitates lung expansion and relieves pressure. The nursing intervention number 2 is going to be distract the patient with the television, and this takes their mind off their comfort. She has just transferred her entire thoughts and processes, and she's actually gone through the systematic approach and developed an impaired comfort care plan and written it all out on her initial plan of care on page 90 of the study guide. You follow me? So as you've watched her, and you guys at home, if you've watched her doing this process, turn to page 90, and you can literally see her filling this out on this particular page.
I'm done.
You are? Okay, if you would just have a seat right there, and I'll be back. Could I have your nursing diagnosis book, please? Is there any other information that you need?
No.
Have you completed all the critical elements for the planning phase of this particular patient care scenario?
Yes.
Okay, and the time that you have now is?
9:56.
Okay, if you would just have a seat right there, I'll be right back.
Okay.